All right. This is Joe Johnson from Cancer Dudes Live More, and I'm here with a special guest today, my very dear dad, Dr. Michael L. Johnson, board-certified chiropractic neurologist. He's been in private practice in Appleton, Wisconsin for over 30 years, and he is a cancer expert and author of the book, You Can Beat Cancer Naturally, which you can find at drjnaturalcancersupport.com. And you can get the book at drjcancerbook.com. Is that right?
Correct. It's a free download.
Awesome. Free download, and there is, I think, over 150 videos on the Dr. J Natural Cancer Support site. Is that right?
Yeah, and we're adding more. It's a good thing.
More videos every day. Awesome. But, so thanks for coming on with me today.
Great. I'm happy to be here. Ready to roll.
All right. So, for a guy who's just been diagnosed with cancer, he's probably wondering, what's the cause? How did it come up? Where did it come from? I know there's not one cause of cancer, but what are some of the factors? What are some of the causes that can play into it?
Sure. Well, one of the biggest things is methyl groups. Your body needs methyl groups, and how you form methyl groups is stomach acid, HCl.
Mm-hmm.
And this isn't to confuse people that have acid reflux or GERD. That's lactic acid.
Mm-hmm.
So HCl with a buffer, potassium, creates trimethylglycine, and that adds 3 methyl groups per cell. So when you're low on methyl groups, you express bad genes, a bad gene like an oncogene. So there's tumor suppressor genes. We all have cancer in our bodies. You and I, as we're speaking to one another right here, Joe, have cancer in our body.
Mm-hmm.
We're quote-unquote healthy because we don't have symptoms.
Mm-hmm.
But it's our immune system that nips the cancer in the bud.
Mm-hmm.
So we have more tumor suppressor genes than oncogenes. So we have more methyl groups creating good genes instead of bad genes.
Mm-hmm.
But when you're diagnosed with cancer, it's highly likely, and there is a test called the basic acid test. It's a urine test that you can check on methylation,
Mm-hmm.
but it's highly likely that you've expressed this oncogene. And the oncogene was expressed because you didn't have enough methyl groups. And so that's how you express a bad gene, and that's where a large part of the cause of cancer, just not one cause, because you need a trigger to express a bad gene too. Maybe you came in contact with a toxin,
Mm-hmm.
a toxic chemical. I'll give you an example. I have a cancer patient in my office today. He's from Texas, and he, as a young man, came in contact with a lot of toluene, a very toxic substance. And so right there, that into your system and that exposure over a long time made him more susceptible. So it comes down to expressing a bad gene over a good gene. You need a toxin. Maybe a toxin, maybe it's the fact that you're gluten reactive your entire life. You don't even know it. You haven't had a test, and that causes you to express this gene. So there are a number of different triggers. But the bottom line is you expressed an oncogene. You have more oncogenes expressed than tumor suppressor genes, and really that's where you end up down the road to cancer.
Mm-hmm.
As you know, cancer loves an acidic environment, and it loves an anaerobic environment, a lack of oxygen. So it's important to keep your pH up. It's important to keep your stomach acid up, so you're creating those methyl groups.
Mm-hmm. And so how can people's stomach acid get depleted? How do those methyl groups get depleted?
Great question. And it starts off with diet.
Mm-hmm.
The standard American diet, which is high sugar, high fat, high salt. And salt isn't necessarily a bad thing if it's good salt, like pink Himalayan salt. Pink Himalayan salt has a lot of trace minerals like calcium, magnesium, zinc, selenium. But it's that white garbage that's over-processed, and it's overheated, and it's the worst thing for you.
Mm-hmm.
So it's all this junk food. I mean, I have some young men in their 20s, 30s, even 40s. They work construction. They go to the convenience store, and for breakfast they get a large Mountain Dew and a package of Ho-Hos. For lunch, they're eating at McDonald's. For dinner, they're eating at Burger King. And that's their cycle. That's what they do throughout the day. So that type of diet can cause decrease in stomach acid. As you age, your ability to make stomach acid depletes. Coming in contact with heavy metals. A lot of us, myself no longer, same with you and our family, but have mercury amalgams. That eventually leaches out. That can deplete methyl groups. Coming in contact with a lot of pesticides and herbicides, chemicals. Who ever heard of BPA until 3 or 4 years ago? Yeah, we've been using it for probably 30 years, and it's in food containers, it's in plastic bottles, and now it's this red flag. So there's chemicals we're coming in contact with today we don't even know are harming us. We probably will not know they're harming us for another 5 or 10 years. The EPA catches up with it. So those are the major causes of depletion.
And so when, say, cancer patient has depleted methyl groups, then what do you do about it? Can you get them back, or?
Well, that's one thing I highly recommend. You've got to change your diet. You have to increase your pH. And normal pH, body pH, is 6.4 to 7.0. And one thing that a lot of cancer patients are doing, and they should not be doing, is drinking alkaline water. Alkaline water that's 8.0 or higher, it causes your stomach to be more alkaline, not acidic. And I've had people drinking alkaline water 3, 4, 5 years. We test their first morning urine pH after 5 a.m. They're still very acidic. The alkaline water hasn't done anything. I've had other people, like this gentleman that's seeing me today, he was told at another cancer clinic to put baking soda in water and drink that 3 times a day. The worst thing you can do. You cannot do that. You need an acidic environment in your stomach. So my point being is, how do you increase it? You start with your diet. You eat a better diet. Secondly, you should be taking HCl and something we call HCl activator, which is the potassium buffer, after every meal. That is a must. If there's one thing that people should be doing, is taking HCl and HCl activator. The second thing is increasing their pH. But HCl activator, I use a product from Premier Research Labs called HCl and HCl activator. There's another product called Digest, which is pancreatic enzymes. So those are the 3 that anybody over the age of 21 should be utilizing. With your kids, what you want to do is use pink salt. Pink salt, when you think about it, salt is sodium chloride. So your body takes that chloride molecule, and when your child makes hydrochloric acid, and the example that I always use is, look at a dog. A dog has 100 times more HCl in their gut than a human. A dog can go eat dog crap. So, HCl is great. Methyl groups are important for protein synthesis. It's how your cells of your body use protein. It's important for phase 2 liver detoxification. Your body has to detoxify when you have cancer. Your liver, kidneys, lymphatic system has to be working. It's important for homocysteine metabolism. Homocysteine, by keeping it low, decreases inflammation in your body. It's important for neurotransmitter synthesis, how your brain works. So methyl groups are vital for your healing, especially if you have cancer.
And so, you mentioned increasing the pH. So you want the stomach to be acid, but you want the rest of the body to be more alkaline. How does one go about making the body more alkaline?
Well, don't drink alkaline water.
Yeah, right.
Increase the amount of vegetables in your diet. That's important. Juicing with vegetables. And it's important when I'm saying this that you juice and eat organic vegetables, because consuming vegetables that are loaded with pesticides, especially from other countries like Mexico and South America, it's causing more free radicals and excitotoxins. It's making you worse. It's causing you to have more toxins in your body. So it's got to be. So you're juicing and eating more vegetables. Drinking good water. By good water, I mean don't drink tap water. Tap water is filled with a lot of chemicals. Chemicals you don't even know about. It's filled with fluoride. It's filled with chlorine. Fluoride and chlorine compete with iodine in your thyroid. make thyroid hormone. Thyroid drives your metabolism, so that's important. And then you probably will have to supplement. Most people with cancer have a pH that's off the charts. I don't know if you can see this. Maybe you can, maybe you can't. I'll hold this up.
Yep.
This is a pH test kit, and it's just test strips. And you get one of these test kits, and it shows you on the back how to read it, and it tells you on the side how to do it. But what it does is you can check your first morning urine pH, and it only goes down to 4.5. Most cancer patients are off the chart low. They're 3.0, 3.5, 4.0. And it takes a while to increase that pH with diet. It takes a while to increase it with supplementation. So you want to take what we use is called Coral Legend. These are all from Premier Research Lab, and we can talk about why in a minute. Allopro and Allomanin and D3. And you have to remember the vitamin D that you're taking. A lot of people don't realize there are a lot of cheap vitamins out there. Even Consumer Reports is onto this. A lot of vitamin D is solvent extracted from sheep's wool. And that is not good. A lot of B vitamins are petroleum-based. They're coal tar derivatives. That's not good. A lot of vitamin C is ascorbic acid. Ascorbic acid is it's not vitamin C. True vitamin C cures scurvy. Ascorbic acid does not cure scurvy. The gentleman that's in my office was using a vitamin C drip, an IV drip. They were using ascorbic acid. It was making him worse. He didn't realize it. And, there's people that will justify, especially nutrition companies, the use of these toxic substances. But why do you want to put something that's toxic into your body, these synthetic nutrients that cause more free radicals, when you want to decrease the free radicals because you have cancer?
And so how many, what percentage of the supplements on the market do you find are poor quality?
Well, I would say the majority.
Yeah.
And the reason I say the majority is a lot of supplements are sold online. They're sold in big box stores. And people think they're getting a deal because it's less expensive, it's cheaper, but you're not. You're actually causing more harm. So very few supplements that I see from big box stores or online test out very well. And by testing, we use muscle testing. Even some of the well-known good, quote-unquote, good vitamin companies, they only test on the 2 polarities. You want to test on the 4 polarities, north, south, east, west. And we demonstrate that to patients who come in our office. I mean, we have a gentleman in our office today from Texas. We have a gentleman coming Thursday. Today is Tuesday. He's coming from Ohio. So, we get people from not only all over the country, but all over the world that come to see us. They're amazed. And what they were saying yesterday was, why don't people know about this? And that's why I have 150 videos. That's why we're doing this interview.
Exactly. Got to put the information out there. Definitely. Right. So you mentioned some of the people that are coming in to see you. What have been some of your biggest success stories of people that have changed their diet, changed the supplements, and really seen some big changes?
Well, I mean, the reality is people are healing themselves. If you have cancer, the first thing you have to know is the body has an innate ability to heal. It has an uncanny ability to heal. And when you think about it, when you cut yourself, it's not what you put on that cut that heals it, it's your body that heals it. It just has to be given the right tools. So, yes, when you see people changing their diet, you see people supplementing correctly, and as I tell people, you may be taking a lot of supplements to begin with, but as the months go by, you should be taking less because you're healing. And so, we have a lot of people that are healing as a result of what they're doing, not only with cancer, but autoimmune disorders and thyroid disorders and migraines and fibromyalgia and just a whole host of different symptoms and conditions. And my downfall is I'm so busy, I don't do enough video testimonials of people saying what great they're doing. And we're going to be doing better with that here in the next few months.
And a lot of these people have gone to all kinds of different doctors, too, and nothing's worked for them when they finally come in to see you, right?
They've been to 10 or 15, sometimes 20 doctors. I mean, again, coming back to the gentleman that's in the office today, he went to MD Anderson. He lives near MD Anderson. He said it's in their backyard. And, they just, all they want to do is cut, poison, and burn. And there is a video on that. And he decided he didn't want that. He has a brain tumor. And it was in his broca speech area. So the area of the left frontal lobe of your brain allows you to communicate. And so it allows me to communicate with you right now. And Wernicke's area, the parietal lobe, it's in the back part on the left side, allows us to understand what's being said to one another. And there's something called the arcuate fasciculus. It's like the telephone wire that connects the two. And so this tumor is in his frontal lobe. Now, the good news is it's not growing. It's stagnant. And it hasn't been growing. And so, that's a really good thing, because cancer, as you know, is abnormal cell growth. And it proliferates. It grows very rapidly. So, to his credit, that's a good thing. So many people have either come to me because, look, I don't want to have people cutting things out of me, or I don't want radiation, or they've told me the cure is worse than the disease utilizing chemotherapy. Or on the other side, they've gone through surgery, chemotherapy, radiation, and sometimes many, many sessions of chemotherapy, and they've said, okay, we're done with that. Or my physicians told me there's nothing more they can do. And my feeling is there's always something more. You can, number one, increase your stomach acid. Number two, increase your pH. You can detoxify your liver. You can work toward clearing out your kidneys. You can look at your pancreatic function. You can look at your energy level. I mean, there's a lot of things.
And now, in addition to like diet and supplements, what are some other things that you recommend for people?
Well, if you're able, exercise. And that's, even if you can get out and walk for 20 minutes, that's a big one. And you want to eliminate as many toxins in your system as possible. So you have to look at everything that you're utilizing. The soap that you take a shower with in the morning, it's filled with toxins, xenoestrogens that mimic estrogen and compete with estrogen on estrogen receptor sites. You have an estrogen receptor on all your cells too. The shampoo that you use, the deodorant filled with aluminum. Why do you want to, when you bind aluminum with the cytotoxins like MSG, monosodium glutamate, or aspartame that you have in diet sodas, the aluminum is absorbed into the brain 100 times faster. I mean, this is scientific evidence. This is scientific fact. This isn't something, off the internet. So, you want to make sure you're not taking in any more toxins. We've already addressed, eating foods without pesticides and herbicides. Stop using pesticides on your lawn. I mean, everything that we're talking about here, as you know, our family has done in the last 4 to 5 years. And the more you study, and the more I've studied about cancer, the more I want to make significant changes, not only in my life, but in the lives of my patients and the general population out there. I mean, I get about 400 or 500 emails a week, and it's people asking questions. What should I do here? And same thing I'm telling you. You've got to make these changes, and they can be gradual, but eventually you have to make them.
Definitely. So getting rid of the toxins in the water and the food and the environment and the products you're using.
That's one of the biggest things you can do, because my view on any chronic condition, and I don't care what it is, cancer, autoimmune conditions, fibromyalgia, thyroid, neurological disorders like MS or Parkinson's, you have to decrease inflammation. That's a big one. Inflammation is just harming your body immensely. Inflammation around any organ is like taking a blowtorch to that organ. And you can tell if you have inflammation in your blood work. You have high homocysteine, as we've talked about. You have high C-reactive protein. You have high uric acid levels. Maybe you have high cortisol. So you want to reduce inflammation. You want to detoxify your body. So your liver, your kidney, your gallbladder, your lymphatic system all have to be working. Same with your gut. I mean, they call it the HCl detox kit. And then finally, you want to increase the function of your immune system. And there are a number of ways that you can increase the function of your immune system. So, part of it is changing your diet. Part of it is taking supplements. Part of it is, like we said, exercising. Exercise, you can go online and check it. It's just, as you know, super beneficial.
Mm-hmm.
Even if you got out and walked for 20 minutes a day,
mm-hmm.
instead of sitting at a computer, in front of a computer all day.
Mm-hmm. Right. And
So those are the three big things. And how you do that, we've addressed it. How is the increasing your pH, get it to 6.4 to 7.0. You want to reduce free radicals and excitotoxins. We've addressed that. You want to deal with infections, dental infection, infections in the gut like parasites or H. pylori.
Mm-hmm.
And finally, many people, many cancer patients are autoimmune. Their immune system is attacking their body. So that's where increasing the function of the immune system comes in.
Mm-hmm. Right. And now what I found interesting too was that in addition to the physical toxins, you can have these electromagnetic kind of toxins that can come into your life.
That's really something I study and study quite a bit, and I address it in my book.
Mm-hmm.
Nobody out there is really addressing it, but
Mm-hmm.
EMFs, electromagnetic fields,
Mm-hmm.
and it's not the electrical portion of the EMF, it's the magnetic portion. Think about it. We're sitting here in front of a computer, probably have Wi-Fi, and we do in our office.
Mm-hmm.
There's cell towers everywhere. I mean, my God, there's T-Mobile advertising they have 40,000 cell towers around the country, and I'm just like, that is insane. That's not good. I go out with some friends, and we were golfing in Las Vegas for a week. We're on a golf course, and I look up, and we're in the middle of a subdivision, and we're right next to the fairway, and there is a cell tower disguised as a palm tree. So it's like crazy. Those people, they're getting fried. So not only that, every time you walk into the store, the doors open automatically. They're using a scanner. All these things, these EMFs are adversely affecting you.
Mm-hmm.
And again, you don't have to believe a word I say. This is all scientific documentation. Go on PubMed.com. Go on the internet. Do your own due diligence.
Mm-hmm.
Find out for yourself. So what I do is to mitigate the EMFs, I use pyramids that absorb that magnetic force. I ground my office. I wear something called a Tektites. It's like a little stone that absorbs EMFs in my pockets. I mean, I want to do as much as I can to prevent the adverse effect from EMFs. On the back of my cell phone, maybe you can see this, I have a little, they're called Q-discs. They absorb that EMF, so when I'm putting it up against my ear, I'm not creating more toxins in my body.
Mm-hmm. Mm-hmm. Right. And you can actually see how these different grounding devices are helping you by doing the muscle testing, right?
Well, exactly. That's what we use as far as the EMFs goes, because you can't see it, you can't taste it.
Mm-hmm.
And so the only way to really tell with EMFs is muscle testing.
Mm-hmm. Mm-hmm.
And when we use Dragonite, I'll give you an example. We went and put Dragonite around a patient's house, and Dragonite, it's magnetic. And the guy was an old dairy farmer. He didn't believe me, so he pulls out a magnet, and sure enough, it was magnetic.
Mm-hmm.
I'm not going to kid you.
Right.
That's absorbing the magnetic portion of the EMF. That's what we're after.
Mm-hmm.
So,
mm-hmm.
But yeah, the only way you can really tell there is muscle testing. And so what we do in our office is we use Western medicine. We use a lot of labs, a lot of blood work, a blood panel, a lipid panel, a CBC with auto differential, a complete thyroid panel. We may do a basic organic acid test, as I mentioned, to look at methylation, to look at B vitamins. It tells you a bunch of different things, energy cofactors, fatty acid metabolism. A lot of cancer patients, Joe, are doing the Budweight technique, which is organic cottage cheese and flaxseed oil. That's great, but if you're not absorbing your fats, what good is it doing you? It's not. So a basic organic acid test will tell you if Budweight is going to be beneficial if you are absorbing your fats.
Right.
If you're not absorbing those fats, there are things that you can do supplement-wise to help you. And that's another issue, is bad oils. I mean, hydrogenated oils, trans fatty acids, all these junk oils that you get with all these fried foods out there in restaurants, that's a toxin. That's another factor.
Right.
So we do the testing, and maybe we do food reactivity testing. Maybe we don't. Maybe we do hormonal testing. Maybe we don't. Depends on the patient. But at the very least, we want blood tests, and then we do kinesiology and muscle testing. And what we're doing with kinesiology is we're just hitting acupuncture points. People are familiar with acupuncture, and we're just testing those acupuncture points. So we combine the two, and that's how we do a workup on a patient.
But it sounds like kind of having that individual approach is really important versus just having them read something on the internet and go and try it out.
Yeah, see, a lot of people, I was just talking to my patient yesterday, there's probably 100 different natural cancer killers out there. How do you know which one is right for you? You don't. That's where the blood work comes in. That's where the muscle testing.
Right. And they can definitely, people can go to your website as well as, is it LifeChanging Care? They can go to find some different doctors in their area?
Well, no, not all those doctors deal with cancer.
Okay, sure.
A select few of us. There's probably maybe 4 or 5 only. So your best bet, if there's, as you know, Joe, there's Dr. Kevin Connors up in Minneapolis, St. Paul. And maybe there's 1 or 2 others that are really addressing cancer naturally in our group. Rest are mainly thyroid, fibro. If it's an autoimmune disorder, that's one thing. If it's cancer, it's quite another. Fortunately, a lot of doctors are afraid to deal with cancer because, as you'll see, and I talk about on my website, the reality is it's life and death. And my patient yesterday makes fun of my accent, but you'll hear me say throughout the video, look, this is cancer, this is life and death. You've got to get serious here. And it's amazing how many people that do have cancer that contact me, and it's like, well, yeah, I started taking this, it didn't seem to work, so I started doing Protocell, that didn't work, so and they're just Laetrile, that didn't work. They're just jumping. And finally, they're 6 months, a year into it, nothing's working. And now they're in a panic. Now they're contacting me saying, now what do I do? So, okay, well, you wasted a year of time there. Let's get down to the nitty-gritty.
Right.
Yeah.
And so it is a serious thing, cancer, but there is hope for people, right?
Well, it's like I said earlier, your body has an innate ability, and it has the innate ability to heal. But there are people, and it's well documented, it's all over the internet, that have literally been told by their physician, go home and die. You get your affairs in order. And 5 years later, 6 years later, 10 years later, they're still here. So, no one can say go home and die. That's playing God. So, yes, you do. Everyone, you should have hope. You should have degree of confidence that, look, if I do these protocols, I'm helping my body. I'm no longer hurting.
And now, what role does kind of more like the emotional, spiritual piece, does that play a role too?
Well, it's funny you mention that because it does. Every single cancer patient, and I'm not a psychologist, I'm not a psychiatrist, but we use muscle testing again. And we'll have them say affirmations like, now I can be healthy. And if it's strong, they're good with it. Their subconscious is good. If it's weak, we need to work on it a little. But every cancer patient goes weak on, now I can love myself, and now I can forgive myself. And then it's, now I can love and forgive, an ex-wife or an ex-husband, a business partner, a sibling, your mom and dad. Mom and dad come up a lot. So, it's that emotional healing is a big part of it. So, I address it in my book, and it has to be all aspects. It can't just be, all right, I'm taking a bunch of nutrition, I'm going to be healthy. That's not it. It can't be, well, I've mitigated all the EMFs. I've got that handled. It can't be, oh, geez, I used to have dental infections. I used to have mercury amalgam. I don't anymore. Now I can be. That's not it either. We haven't talked about it yet, but there's something called interference fields. It's interfering traumas that interfere with the meridians. So the correction there is mud packs. So I've done that. So now I know it's and emotions. And emotions it has to be all of those. It has to be all inclusive. It has to be a holistic approach. It can't just be 1 or 2 things. And ooh, I'm healthy.
Mm-hmm.
That's just not the answer.
Right. And so what's the latest website where people can get the book from?
The cancer book?
Yeah.
It's drjcancerbook.com.
Okay, drjcancerbook.com. And some of the like the pH strips and the different supplements and some of the different grounding devices, those are all at drjsupplements.com. Right?
Yeah, drjsupplements.com. Yeah, everything's predicated with the Dr. J.
Right.
Just keeps it simple.
Yeah.
But yes, drjsupplements.com. If you're interested, and we have some videos there too. We have videos there.
Yeah.
We're all over. I'm on YouTube. There's a bunch of videos on YouTube. That is just Dr. Michael Johnson is our YouTube channel, and just share the information. That's try and help us spread the word. And that's why I appreciate doing the interview with you.
Yeah, definitely. So, do you have any final words, final advice for a guy who's got cancer?
Well, yeah. Number one, it's very fearful, so don't give up hope. That's the bottom line. And support yourself, family and friends, and just those are the two biggest things: is fear and supporting yourself and having a good network. So, by that I mean, seriously, eliminate as much negativity in your life as possible. So if you have some caustic relationships with people are literally dragging you down, they're the Debbie Downer types, just move away from those people. And then look and investigate and read my book, read other books, and do what's right for you. Because what's right for you may not be right for the person who has the same exact cancer, that lives a mile from you, 10 miles from you. So those are my two best pieces of advice: is don't be fearful because your body has an innate ability to heal. And secondly, support yourself with a strong group of family and friends.
Awesome. Well, it's been great having the interview today. I'm lucky for the support having you. It's part of my strong support system. And this has been a lot of fun. Thanks a lot.
I appreciate it, Joe. I love you. And for those of you, if you read my book and watch my videos, at the end I always say, don't forget to tell the people you love that you love them. And if you have kids, make sure that you tell them that you're proud of them. So I'm proud of you.
Oh, thank you. Thanks.
See ya.
I love you as well.